Hello. We are so happy that you decided to join us and get more information about our Optimal State Mental Health Specialist Program. This is a really special program that we're offering to people who either have a certified yoga therapist certificate, CIAYT, but we're also opening it up to people who are trained in the Krishnamacharya Desikachar tradition, specifically if you have a 200-hour or a 500-hour teacher training in Vini Yoga. If you have that, we feel you'll have the foundation that you need to join us in this mental health specialist program. The other person that might work out for this program is someone who has at least an Ayurvedic practitioner certification, meaning they have studied Ayurveda, they understand Ayurveda, and I think you guys could jump in here too. So our next program starts in January. And I just want to tell you a little bit about it because I think it's a very, very unique program, and I think it's very much needed in our society today. Some people ask me, well, what is different between yoga therapy and psychotherapy? There's so many psychotherapists out there that are now starting to use mind-body techniques in their practice, which I completely applaud. I've been teaching psychology at a university for over 20 years, and I feel like the issues are in the tissues. It's not just up in your head. It's not just changing your perspective and your thought patterns. It's really about learning how to regulate your moods, how to regulate your energy, how to regulate your triggers from the bottom up. And I'm going to talk a lot about that today in this video, is what is it that yoga therapy offers when we talk about a bottom-up approach, meaning the body trains the mind, which is a little bit different than what most psychologists and mental health professionals have done, which is how do we use the mind to heal not only the mind, but also the body. So that's what we call top down. And I'm going to show you how these two things come together and why getting training in something like yoga therapy for mental health is actually a really cool thing. Even if you're a psychotherapist and you want to use this in your practice, of course you'd have to do the prerequisites. But especially if you did a 200-hour in a Vini Yoga tradition, then you could jump into this course. The other thing that I want to talk about is how we assess in yoga therapy, and it's very different than what you might see in a mental health profession. In mental health profession, the person is given a diagnosis. You have generalized anxiety disorder, or you have bipolar, or you have schizoaffective disorder, certain diagnoses. In yoga therapy, we try not to give someone a label or a diagnosis. In addition, if there's any severe mental health concern at all, we will always be working complementary to the psychologist. So we do want to have that licensed healthcare practitioner there for support and to guide the case. What we're doing in yoga therapy is quite different, and it brings up a lot of emotions and thoughts and memories from the tissues back to the brain that the student or client can then bring to their therapist. So the 4 pillars of our yoga therapy for mental health program are the signature optimal state of living assessment program, which I'll talk about in a minute, this idea of using Vini Yoga as it applies to mental health. And Vini Yoga is a really beautiful yoga system that focuses on health and healing, tying in Ayurveda, which is the ancient science of life, and then using all of that together to be reinforced by modern day neuroscience and some of the latest mind-body techniques that a lot of Western medicine is starting to understand. So those 4 pillars, the optimal state system, Vini Yoga, Ayurveda, and modern psychology and neuroscience, those are like the 4 legs on the table. So let's start with this idea of optimal state yoga therapy. I want to show you how we assess a client differently in yoga therapy than we do in psychotherapy. In psychotherapy, there are different scales of measurement. There might be the Myers-Briggs, there might be the Beck's depression scale, the anxiety scale. There's all sorts of things. And they're all based on a Western view, a Western biomedical view. But what I'd like to share with you is the optimal state of living view of mental emotional health. And basically what we have here is we're basing this on a very, very ancient theory called Sankhya theory. And it eventually developed into Ayurveda. And we have different zones here. We have the white zone, the blue zone, the red zone, and the gold zone. And if you read some of the words on here in the white zone, not enough structure, lack of support, lack of confidence, lonely, indecisive, overwhelmed, restless, anxious, fearful, difficulty focusing, and feeling isolated. These all come from Ayurveda and what we call having a high Vata, V-A-T-A. And in yoga therapy, we have very, very specific mind-body tools, postures, breathing techniques, meditations, maybe even chanting, to help someone come out, to pacify the white zone and come into what we call the gold zone. They'll be given a daily practice to help them soothe and calm. And this daily practice will be individualized just for them. It's not just for their mind, but it's also for their body. They might have a hurt knee. They might have a low back pain. They might have a little bit of a shoulder pain. Again, if it was a very serious problem, we would also work complementary with a physical therapist. But if it's aches and pains and nothing too serious, we write them a daily practice that will help them reduce their white zone Vata and take into consideration their body as well as their spirit. We might put things in there for helping them to find more joy, find more gratitude, find more peace. So this is what yoga therapy is it's actually helping people to come into balance. We call this salutogenesis. A way of feeling ease and comfort in the world, in your body, in your mind, and your spirit. Now, if someone came to us with what we call high kapha, and that's what I'm calling the blue zone here, if they were kind of stuck and feeling fatigued and negative thinking and depressed and low energy and lethargic, we have a completely different set of yoga therapy tools that we use to take you out of the blue zone and get you into the gold zone. And this is beyond just a few breathing techniques that you might get in your normal session with your psychotherapist. We will set you up with a whole lifestyle regimen to help get you out of the blue zone, from what types of things, according to yoga and Ayurveda, you could eat or not eat, to what types of exercise, cardiovascular versus weight training, would be best for you, what types of yoga postures would be great for you, what types of breathing techniques, certain meditations and objects of meditation. This is why it takes over 1,000 hours to become a yoga therapist, because it's really a lifestyle medicine, which is, as I said, it's a little bit out of the scope of a regular psychotherapy or mental health training. It really is bringing kind of, yoga with physical activity, with ways to perceive yourself differently, with breathing techniques, all of it based on basically the subtle anatomy in the body and how are we going to clean out your meridians, your energy channels, and how are we going to get everything in balance, body, mind, and spirit. There are other times where the student might be in what I call the red zone, and in Ayurveda, they call this having a pitta imbalance, B-I-T-T-A, and you might feel kind of frustrated and resentful and impatient and angry a lot. And when someone has red zone imbalance, we have a whole nother set of tools that we choose for them to help them get into balance. Everything, again, total lifestyle could be how to sleep better, could be what you need to do at a certain time of day, could be try some coconut water to kind of cool and soothe. So again, it's lifestyle medicine. It goes far beyond just working with someone's mind and giving them a breathing technique. Again, the issues are in the tissues, and we're trying to actually change the tissues through the energy meridians that many people know about, is used in acupuncture and traditional Chinese medicine. We have the same thing in yoga therapy. The difference with yoga therapy is that it's all about self-empowerment. So in yoga therapy, when we teach our student or client these lifestyle management techniques to help them regulate their autonomic nervous system, to manage their moods, to manage their energy levels, to soothe their nervous system, when we teach them all of this, we expect that they then implement these practices into their lives, that they have some adherence, or what we call compliance. And so they're going to be the ones who have to get up and have hot water first thing in the morning. They're going to cut their coffee consumption from 7 cups to 2 cups. They're going to have to get out for that morning walk in nature and then come back and do a few yoga postures before they get into the shower and do skin brushing. So we have this whole set of lifestyle tools based on the ancient texts of India. And this is what we want to share with you, is how to set someone up for lifestyle medicine success through yoga therapy. And so when I hear psychotherapists and psychologists, and keep in mind that I have a PhD in educational psychology, so it's not like I'm trying to put anyone down. I love psychology. And I want to tell you that what we're teaching in yoga therapy is way, way, way beyond the scope of practice for a psychologist. It is, as I said, lifestyle medicine based on the ancient teachings, and that's why it takes 1,000 hours to learn how to do it, minimum, and there'll probably always be, continuing education after that. So this is one of the 60 charts I've created. This is a mental emotional state assessment chart, but through the optimal state system, we have created 60 different charts. We have probably 25 of them for assessment based on the ancient texts of India. And then we have another 30, 35 based on what are the tools that you're going to use for white zone, blue zone, red zone to get into the gold zone. So we might have a chart like this full of pranayama ratios. We do have a chart like this for pranayama techniques, objects of meditation, exercise, food. We have charts for everything. And what's really cool about that is that not only does the yoga therapist have a really concrete way to work with their clients, but while they're working with their clients with all these charts, the clients start to learn the system, because let's face it, it's visual. Anything that's visual goes into your older brain, as opposed to, cognitive or words come up here. They don't always stick in the prefrontal cortex. So we're going in with a visual and helping the client to understand, wow, every single one of these charts, I'm in the blue zone. Whoa, what does that mean? And how can I fix that? And then they start seeing all the lifestyle medicine tools and techniques that they can use to get out of the blue zone and get into the gold zone. And so it's a system that the yoga therapist uses, but eventually it's a system that the student or the client themselves uses for self-empowerment. I'm to the point now, and many of my trainees are to the point now, that every single morning I do a check-in with my charts, and I figure out, okay, where am I out of balance, and what tools do I need to use to get into balance? So that's another really cool thing about this program, is you're getting this whole professional development, but you're also getting personal development. I know many people that have gone through tons and tons of yoga and yoga therapy training, and they're still wildly out of balance because they didn't take the time to do the personal work. They didn't have a simple system like this to figure out that they're out of balance. So when they come to me and they say, hey, I want to join your yoga therapy program. I know I already have a CIAYT, but I want to join you guys and take, a year or two. I say, come on in. And they're always surprised when they start realizing how out of balance they personally are. So I think that personal growth and development is a big part of what we're doing here, is helping the yoga therapists themselves to learn the system and come into balance so that they can share that with other people. So these are some of the things that I'm really excited about that I want to share with you if you're interested in learning the optimal state system. And another thing I'll say is that we base all of our practices for ourselves and for our clients on Vini Yoga, the individual application of yoga. And Vini Yoga came from Krishnamacharya and TKV Desikachar, and that's why I'm inviting people who have a 200-hour or 500-hour certificate in Vini Yoga. We especially want you because we're right in alignment with that. But we will also train you if you're coming from a different tradition. The Vini Yoga tradition is so remarkable because it really maps out all the different postures and what their benefits are, what their contraindications are, why you might use them, when you might use them. Same thing with all the pranayamas. We go into great depth and detail talking about each pranayama and what are the potential benefits and contraindications of those, and what order would you put them in, and when would you use a ratio versus a certain technique. Should I use Nadi Shodhana or alternate nostril breathing with a pause after exhale, or should I use alternate nostril breathing with pause after inhale? These are the types of questions. Should I put Shitali, cooling breath at the beginning of the practice or the end of the practice, or both, and really getting specific about these tools. In addition, we'll talk all about different objects of meditation and how it is that we do choose an object of meditation and the qualities behind those objects of meditation, along with if the person's open to it and they want to do some simple chanting, either in their traditional religion or in the more Vedic sense and the Indian mantras, we will teach those also. So this Vini Yoga tradition is so rich with the tools of yoga therapy, and I want to share those with you in this program. I'm often told by people who have been through full yoga therapy programs that they want to come back and do the first year of our yoga therapy program and really get clarity about all these different tools and technologies that yoga and Ayurveda have to offer, because they feel like somehow they missed out on that piece. They went to maybe a 200-hour yoga training in a very vigorous exercise type yoga training, and then they come into yoga therapy and their program assumed that they knew all the little intricacies of the different pranayamas and meditations and asanas and postures, but they didn't know that from the healing side of it. They just knew it from the exercise side of it. So a lot of people are coming back to us and telling us, hey, I want to take year one. I really want to understand all the fundamentals very concretely. Also in the program, we use Ayurveda as the basis. And I'm going to say we use Sankhya because that's how I was taught. I wasn't taught as an Ayurvedic person. I was taught looking at the qualities, the 10 pairs of opposites, looking at the qualities that are in the human being. For example, redness in the skin or dryness in the skin, or different things. We teach you how to look at the human being and ask the correct questions, interview them correctly so that they can give you the information you need to understand what parts of their system are out of balance. In the Ayurvedic portion, we have a 6-hour assessment course, which takes you through all the layers of the human system: the physical, the breath, the mental, the personality, the emotions, the spiritual. We take you through all those systems in our assessment course and teach you how to evaluate the person in front of you and how to know what kind of questions to ask them in order to get the information you need to understand which part of their system may or may not be out of balance, and then what qualities do you need to cultivate in that human being to bring them into balance on any of those layers of the human system. So it's a pretty sophisticated assessment system, but we will also teach you how to, in a very concrete way, bring that person back into balance. And most importantly, we'll teach you how to teach them to keep themselves in balance. Because once you get in balance, it feels so good, you want to stay there. So a big part of what you're doing as a yoga therapist is teaching the client how to take care of themselves. As I said before, it's all about lifestyle medicine. What do I need to be eating this morning? What do I need to be, this morning I woke up and it was very cold out. And so I started with hot water. And then I got in the bathtub and I did some abhyanga oil massage. These are things that we like to do in the fall part of the year to keep ourselves in balance. In, July, I might not want to get up in the first thing in the morning and take a hot bath with oil. That would be the wrong time of the year. So we're really teaching people how to care for themselves and how to keep their bodies and minds and spirits in balance. So there's a whole component of Ayurveda that we'd like to share with you. And then last but not least, in our program, we are very, very interested in connecting all of this information to modern day neuroscience and mind-body medicine. There's so much great evidence-based medicine coming out right now on these topics. And so I just want to share with you for a moment how it is that we as yoga therapists work with people to help them come into balance, both from a top down, from the mind to the body, but also from the bottom up, from the body to the mind. We're starting to understand in neuroscience that there's so much going on in the body sending these signals back up to the mind, that your gut instinct, your gut intuition, it truly does have neurons that are sending things all the way back up to the brain. So the goal of yoga therapy, and as I call it lifestyle medicine, is to help bring someone into homeostasis, bring their autonomic nervous system into homeostasis, bring their mind into homeostasis, so it's not too anxious, not too depressed. It's in that nice sweet spot in the middle where you're feeling ease. And how to bring the body into proper physiological functioning, where you're getting enough sleep and you're waking up feeling fresh and you're hungry at the right times and you're, not eating all the time just because you're bored. Help getting the body in function. That's what I mean by homeostasis. And this is what makes yoga therapy so unique, is we know how to get the autonomic nervous system functioning well. We know that primarily people should be living in their parasympathetic nervous system, their PNS. And every time there's a little stress, they jump up into the sympathetic nervous system to meet the crisis, and then they're hopefully quickly and efficiently going to get back down and use their parasympathetic nervous system again. That's what we mean by proper autonomic nervous system functioning, is your PNS, jump up, SNS, get back down, PNS. That's what is supposed to happen, because as soon as you go into that sympathetic nervous system, everything turns on. Everything, your nervous system, your mind, your body, your physiology, it all turns on. And that's not a healthy place to live. Unfortunately, many people in today's society are not getting good rest. They're waking up stressed out, already in their sympathetic nervous system. They have a bunch of coffee. They listen to the news on the way to work, unfortunately. They are stressed out all day long. They come home grouchy and exhausted and tired and have a few drinks and fall into bed and then do it all again the next day. That is not homeostasis. We need to help people correct these lifestyle patterns. And this is what yoga therapy does. We help people to understand how out of balance they are and how to get back into balance. So let's start from the bottom up, because I think this is one of the things that yoga therapy is phenomenal at. These bottom up strategies where the body tells the mind what's happening. The body, the issues that are in the tissues get resolved, which makes the mind function more clearly and effectively. So first of all, there's a whole new body of research by Stephen Porges and other on vagal nerve toning. and how this vagal nerve, which is the 10th cranial nerve, comes out of the back of your cranium, your head, and goes all the way down and innervates so many organs. This is a huge, huge nerve, and it tells your spleen and your liver and your gallbladder and your intestines and your heart, and it tells all these organs whether they should be turned on for the sympathetic system or if they should be in rest and digest, the parasympathetic. So we're learning through modern science so much about this importance of this vagal nerve, and in our training you'll hear all about the latest research in that. And there's, as I said, Stephen Porges out there, there's Bessel van der Kork, who is all about the body keeps the score. He has a wonderful book out. We'll talk about heart rate variability as a measure of vagal tone and how there are 4 parameters that actually test vagal tone. A lot of people are just trying to use one, and there's actually 4 that we need to be using. We'll talk about how to bring the heart rate into a balanced place, bring the blood pressure into a balanced place. We have tools and technologies in yoga that can do that pretty quickly and effectively. It's really exciting to take someone's blood pressure at the beginning of the session, take them through about 30 minutes of practice, take their blood pressure again, and see it change completely. It's almost shocking when you see this. So through yoga therapy, we know exactly which tools and techniques are going to help bring that heart rate and blood pressure down. And then, of course, the message to the brain is, it's cool, we're fine, don't worry about it, we're good now. The more we can give the brain those messages from the body, the happier, healthier we will be, the more ease we will have, and you just feel good. You feel much better than when you're stressed out and your heart rate's up and your blood pressure's up and you're agitated and the way that most of us walk around in the world. Some of the other things that yoga therapy does from the body up is teach people how to have really good posture, right? That's obvious with yoga practice. But we also focus on the nervous system and how to get the nervous system to react properly, to not get triggered into the sympathetic nervous system when there's no reason to be triggered, to be able to do self-talk, to soothe yourself, and then do yogic practices to soothe yourself when you've realized that you've gotten, out of balance again. This has an impact on the tightness of our muscle tissues. I had an interesting experience recently that I had injured my knee, and there is some structural damage, and my nervous system had been in sympathetic tightness for a good number of weeks. I went to the ocean for a day and just relaxed, sitting on the beach at the ocean, listening to the waves. It was so wonderful. And what do you know, at the end of the day, my leg could straighten much better. Not because I had stretched it out, but because my nervous system had relaxed, and the nervous system innervates the muscle tissue. And so when my nervous system relaxed, the muscle tissue relaxed. And it was funny to see how a lifestyle, intervention like, hey, go to the beach for a day, actually made my legs straighter. That's what I mean by the tissues. And that's the kind of thing we teach you in yoga therapy. The organ and the gland functioning when your body is humming along in homeostasis, and there's not this fight or flight response or freeze response or panic or triggering all day, every day, everything functions better. Your thyroid functions better, your adrenals function better, your, everything, your liver. Very, very different functioning of the organs and glands when you're in that homeostasis type feeling all day long. And then we also talk about the impact of deep breathing. There's so much great research coming out right now on how the cardiorespiratory system and the nervous system are very, very linked, and how the breath is almost like a dial that we can turn the dial down through certain breathing techniques, which calms the nervous system, or we can turn the dial up through other breathing techniques, which kind of wakes you up and makes you more alert and focused in case you need to take a test or give a presentation. So in yoga therapy, we can teach you how to dial down the nervous system or dial up the nervous system, depending on if you need to wake up, be alert and focused and on it, or do you need to go to bed at night and get a good night's sleep? We can use breathing techniques to do that. So you can see these bottom-up strategies. They are really, really important. Modern neuroscience is all over this, but I'm going to argue that it's not just a breathing technique. It's not like we can just teach someone like, oh, do this, 6-count inhale, 6-count exhale, or, whatever technique, and think that that's going to change the vagal nerve tone and the heart rate and the blood pressure and the way that the nervous system works and eventually the tissues, as I described, and the organs and the glands. A breathing technique a couple of times a day may or may not be able to create the kinds of effects that we're looking for. But in yoga therapy, when we teach lifestyle medicine for a morning routine, how do you get up in the morning? What do you do? First thing, second thing, third thing. What does your daily 20 to 30 minute practice look like? Designed specifically for you and your body and your mind and your spirit. What kinds of food choices might you choose to keep yourself in balance? What types of other exercise besides yoga asana or postures might be good? When would we want you to be swimming? What time of the year? Versus riding your bike, versus lifting weights. Also getting into choices of where you even might want to live based on your body and your constitution and what might be helpful for your constitution. What types of relationships do you want to be in? Ones that are supportive and loving and kind. All of this is explained in the ancient yoga and Ayurvedic texts. And so we come from that lens. And as I said, oftentimes we are also working in combination with a physical therapist, an occupational therapist, or a psychologist. We're complementary. We're still honoring those fields of study, but we're also bringing these ancient tools and wisdom that those fields actually don't know anything about. And as I said, that's why it takes 1,000 hours to become a yoga therapist. It's not just a few breathing techniques. It's actually lifestyle medicine. It's the whole gamut based on the ancient teachings of India. And so, some of the top-down strategies that I think a lot of psychologists are using, but we also have a whole framework in yoga and yoga therapy, is this awareness of yourself, body awareness, breath awareness, mental awareness, but also your deeper self, that part of you that is all-knowing, that part of you that never changes, that part of you that's always been here and will always be here. We talk a lot in yoga about that deeper self and how if we can really get in connection to that deeper self, the body, mind, and spirit, the little self, will have more trust, have more faith, have more confidence. In yoga, we call this Shraddha. So again, we're looking at it through the lens of the ancient texts. We also can advise about self-regulation of your mood, how to manage your mood. I showed you the mental emotional state tool. I have a lot of people put that tool up on their refrigerator and evaluate themselves all day long from the perspective of Ayurveda, red, white, blue, gold zone, and take note all day, every day about where they are. We could do the same for energy levels. We can do the same for body sensations. Like I said, we have charts for all of these. This idea of self-empowerment where the client actually takes responsibility for their life and getting themselves into balance. They don't just get to come to the yoga therapist and complain twice a week about, all the terrible things going on in their life. They actually are challenged to create a new lifestyle for themselves through these ancient teachings. Some of the other things that we can help people with in yoga therapy are self-regulation of attentional focus. A lot of people are very, very ADD, ADHD, And there are so many focusing tools that we have in yoga and yoga therapy to help people take their minds from all over the place and unable to focus and too many balls in the air and, oh my gosh, nothing's getting done in my life, I'm overwhelmed, to how are we going to help you set goals and prioritize and figure out, based on your values and your belief structure, what it is that you want out of this life. And it really helping people hone in on that, again, using the tools and the teachings and the ancient wisdom of yoga, based on all these ancient texts, in combination with their therapist, of course. But I think it's a different set of tools than you will get in psychotherapy. In fact, I know it is, because as I said, I have a PhD in educational psychology, and I've been teaching psychology for 21 years now, going into my 22nd year at a university. So I understand that scope of practice, and I understand yoga therapy scope of practice, and they're different. I'm just going to say one is lifestyle medicine, and that is yoga therapy. So through all of these top-down strategies based on yoga and the bottom-up strategies based on yoga, we get yoga therapy. And yoga therapy is specific to the individual. It isn't that you're in a group yoga class and the teacher says, all right, everyone, now I would like you to do this breathing technique. And for 40% of the people, that's going to work great. For another 40%, it's going to give them a headache and some eye twitches. And for another, 20%, there's not really going to be a result for them. They're going to be like, okay, what was that crazy thing? That is different than yoga therapy, where a yoga therapist has the knowledge of all the tools available, all the postures, all the pranayamas, all the pranayama ratios, all of the meditations, all of the mantras, all of the lifestyle-based advice, and knows specifically which pranayama and which food and which meditation technique is going to work for that person at that time suffering from XYZ problem. To have all of the knowledge of all of these tools and know what to use for that person is yoga therapy. And that's very different than, I'm going to teach everyone that comes to see me the long exhale technique because everyone needs to reduce their stress. This is true. Most people need to reduce their stress. But when we do yoga therapy, we really get specific. And then there are complex cases. Somebody comes with autoimmune disease, high blood pressure, depression, and a hurt back. That's why you need 1,000 hours of training in yoga therapy, is to really understand that. And when it comes to mental health, yoga therapy for mental health, unfortunately, people don't just come with anxiety. They don't just come with depression. They come with anxiety and a knee problem. They come with depression and a low back problem. So this is, when we teach yoga therapy for mental health, we actually do need to know how to help the physical body, because we know that what's going on in the mind actually manifests in the physical body. So I think there's still a lot of hope for yoga therapy. I think we're just getting started. I think the world is just starting to understand what it is that we do. And as I said before, I believe that the gift that yoga therapy brings is this idea that something starts in our mind, some kind of dis-ease starts in our mind, and over time it moves from very subtle, gains some momentum, knocks on the door lightly, gains some momentum, knocks on the door a little more hard, gains some momentum, and then there's a physical knock on the door where your body actually manifests some type of suffering. And in yoga therapy for mental health, we're trying to catch it when it's in the subtle realms. We're trying to catch it when it's anxiety and depression before it manifests into something else, right? Like autoimmune disease or 20 years of insomnia or something like that. And what I think is really cool about yoga therapy for mental health is, again, we're working from the tissues up, not just the mind down, and teaching that whole lifestyle regimen, that whole daily routine from the moment you wake up. Here's the things you can do to get yourself back in balance till the moment you go to bed. It's not just a breathing technique or try to meditate for 15 minutes. There's lifestyle medicine routine that comes with each zone that we talked about earlier. Whether you're out of balance in the white zone or the red zone or the blue zone, there are totally different tools and technologies that are going to bring you into the best version of yourself you can be. That's one more thing I want to say about yoga therapy for mental health. Our goal is not to cure some disease or some pathology or even reinforce this diagnosis that you've been given. Our goal is to make you the best version of yourself that you can be, wherever you are. It's going to be different for every single human being. So how can you feel good in your body? How can you trust something larger than yourself? How can you find the most mental, emotional stability possible from the bottom up? That's where we specialize. It's from the bottom up. And that's why we include all the latest neuroscience and body-mind practices in our yoga therapy for mental health training. So I cannot wait to share the entire course with you. It is a 7-month course. We have a 9-day module. It's really an 8-day module where we go 4 days on, 1 day off for a little rest, and 4 days on. So that module is 9 days total. Then throughout the 7 months, we meet every Friday to do online studies for an hour. We go over a case study. And then we have our second module, which again is 9 days. It's really 4 on, 1 off, 4 on, but we'll just say 9-day module to finish up the 7 months. We would love to invite you. If you are a CIAYT, come on in. If you are well versed in Ayurveda, we'd love to talk to you and see if it's a good fit. And also if you have a 200 or 500 hour training in the Krishnamacharya tradition or the Vini Yoga tradition, we will also talk to you and see if you're a good fit for our program. So our next program starts in January. It would be great if we could start talking now and get you the information you need to make a decision. And we are really looking forward to meeting you. Thank you for joining me, and I hope to see you soon.